Hello, I'm Matthew Weinstock with Hospitals and Health Networks, reporting to you live from New Orleans and the 2013 HIMSS Conference and Exhibition. More than 30,000 attendees and 1,100 exhibitors are gathered here this week. The meeting actually got underway yesterday at the HIMSS CIO Forum. Judy Murphy, Deputy National Coordinator at the Office of National Coordinator for Health Information Technology, told the gathering of CIOs that ONC is focusing in on two critical areas: patient engagement and patient-centered care. On patient-centered care, Murphy said that Stage 2 meaningful use regulations are seeking to accelerate interoperability. Several of the CIOs I talked to afterwards said that was the right approach, but they would also like to see more attention paid to standards development. You can read more about Murphy's speech in my blog below. I also had the chance to catch up with Russ Brenzel, incoming CEO of CHIME. He talked about the challenges facing the field and the need to start showing measurable outcomes for the capital being spent on health information technology.
Well, if you look at the transformation of the role of the CIO, really what's occurred is, if you look at, for lack of a better term, the CIO 1.0 really was the tech manager. They were the person hidden in the basement with all the tech folks in there, and their job was just to make sure the basic technologies worked. What's really evolved over a period of really the last 5 to 10 years is they've really become the transformation leader, and in which this process of they went from technology to application portfolio manager to now really involved in process transformation and really leading change in the organization. What we're seeing now with the need for healthcare transformation paired up with HIT automation really is a perfect catalyst for each other. So what we can do is automation can help healthcare transformation, and healthcare transformation can utilize the automation processes really to get monumental gains in this improvement cycle we do need to have. The role of the CIO really has become the facilitator of that change and adoption of technology to accelerate that change. If you mirror it up with really the meaningful use adoption, and the fact that most are ending into that meaningful use stage 1 cycle of that, really that's just the adoption cycle, getting all the technology and pieces in place. So for a vast majority, we're really at that point of the adoption. Now what you start looking for is the ability to take that, create data and information and knowledge out of that, to start that transformational process. Most are there. Even hospitals as well as the medical groups that are out there now. If you look at this whole continuum of care, there's an absolute need for them to collaborate in this change process. A patient isn't in just one environment. If you look at probably 90% of data is created in the outpatient world, not just the hospital world that's there. The hospitals and the medical groups, the physician leaders that are out there, led and facilitated by many of the CIOs, are responsible for getting this change in outcomes that are coming. But the pace of change has probably created a little bit of tension between everyone in this, and that the demand for excellence in these services are probably pushing the vendors faster than they could reasonably put out software and solutions in a way that really is meaningful to the organizations. With that being said, they absolutely are tied together now. Their success is our success, and our success is their success. If you look at the cycle of change and what comes out of Washington through the NPRM process, and they are behind, but so are the hospitals and the medical groups and the provider space, mainly just because of the cycle. If you look at any change cycle, 2-3 years is a normal cycle of change to get the information, get the technology, adopt it, look for the benefits. We don't have 2 to 3 years in these cycles. You know, we have 6 months, a year. When the final rules come out, they have to put out a release and a change cycle, sometimes a whole new product suite. So they're not behind because they're not doing their jobs. They're behind because of a legacy environment of change doesn't meet up with the current change requirements from a timing perspective. Part of this is the ownership process. CIOs have been working very hard over the last few years to appropriately transfer ownership for change and outcome management to the appropriate business or clinical entity within an organization. Now that that transfer has occurred, they realize how difficult optimization and benefit realization is. And I think that change has really helped organizations understand that there's huge operational costs and workloads to post-go live the real work of optimizing a system. One, obviously, we want to look for ways for Chime to have a bigger impact in the industry and continue to expand on its mission it has to support the CIOs and the vendor foundation. And we want to make sure that we grow the organization to meet that need. As the premier organization, we want to make sure we're meeting the needs. And we've heard quite clearly from our foundation and our CIOs that there's new opportunities we should be looking at. The other is to continue to grow the organization, and that is making sure that we're developing that next level of CIOs through our boot camp and through other education opportunities, as well as to reach out to non-traditional CIOs, secondary levels of care, nursing homes, long-term care. And we want to make sure they're all part of this continuum as well. It's been a traditional hospital, now medical group. We want to make sure we have the entire continuum of individuals that are there. But most importantly, I think the part that we've got to be on the absolute very tip of the spear on is public policy. Being involved in the drafting and development of where these next phases of healthcare transformation goes, rather than waiting for these laws to be passed and then going, now how are we going to deal with it? We want to be involved on the front end of developing our new healthcare system.
Also below, you can read a blog about an innovative partnership being announced today by Citi and Aetna. We'll be reporting all week from HIMSS, so be sure to check out H&HN Daily. I'm Matthew Weinstock. Thanks for tuning in.